Dear friends, welcome to my Geriatric Medicine channel. I am Dr. C.G. Keshavamurthy from Shivamogga. Today, I am going to discuss about osteoporosis. The osteoporosis, we have heard of it, but what it is? What is osteoporosis? Does it affect only women or do men also get affected? That's the question. Osteoporosis is a porous bone, is a disease characterized by low bone mass and structural deterioration of bone tissue, leading to bone fragility and an increased susceptibility to osteoporosis. Men as well as women suffer from osteoporosis, a disease that can be prevented and treated if proper care taken much earlier in the life. Osteoporosis is a silent risk factor for fractures of the bone. As hypertension is a risk factor for heart attack, we all know that hypertension is a risk factor for BP, risk factor for blood pressure, stroke. Similarly, osteoporosis is a silent risk factor for fractures in the elderly people as well. Is it possible to make early diagnosis from the symptoms of osteoporosis? Is the question. Yes. It is often difficult, but it is possible. Osteoporosis is often called the silent disease because bone loss occurs without any symptoms. People may not know that they have osteoporosis until their bone becomes so weak that a sudden strain or bump or fall causes fracture. Fracture of the hip bone, the thigh, the wrist, etc. can happen. Even the humors can undergo fracture. What are the risk factors of the osteoporosis? Certain factors are linked to the development of osteoporosis or contribute to an individual likelihood of developing the disease. So, the risk factors are increased age, senior citizens above 60, 70, 80, etc. The female sex because they lose their estrogen production after menopause. The Asian race people. The positive family history. If the parents suffer from osteoporosis, children may also suffer from osteoporosis. Drugs like steroids taken for asthma, joint pains, etc. The thin-bodied individuals. Low calcium intake in the previous life before onset of osteoporosis. Then the sedentary life, if the patient doesn't be active in their daily life, they always sitting on the chair and munching something, that is sedentary lifestyle, will cause osteoporosis. Cigarette smoking is another factor. How to confirm osteoporosis before the occurrence of fracture? Is there any test for it? Yes, there is a test. According to WHO, World Health Organization, the best criteria for diagnosis of osteoporosis is the measurement of bone mineral density, BMD, bone mineral density, especially the calcium density is measured. A bone density test can detect osteoporosis before fracture occurs, predict chances of fractures in the future, determine the rate of bone loss and or monitor the effects of treatment. If the patient is taking any treatment, it can be measured with bone mass density, bone mineral density test. Is there any reliable test by which BMD can be measured accurately? Yes, there is a DEXA test that is called dual energy extraabsorptiometry is considered the gold standard among several techniques that provide an accurate BMD assessment by of multiple skeletal sites and ultrasonogram of the bone. This gives the accurate result. Dear friends, is there any way by which osteoporosis can be prevented? Yes, prevention programs should be developed for patients at risk and for patients with the diagnosed osteoporosis. Both of them should undergo treatment. Approaches includes adequate intake of calcium and vitamin D, regular exercise and other efforts to minimize the risk factors of risk of falls, smoking cessation and good general nutrition are the key factors in the prevention of osteoporosis. Dear friends, this is about the osteoporosis in brief. Though I said I will discuss it, it is discussed in very briefly. So, go through this, subscribe it, like it, share it among your friends. So, thank you very much. Jai Bharat, Jai Karnataka.